The CDC wants to create a new team to support training at its Injury Prevention and Control Center. The training would improve data collection and analysis across the organization. Linda Degutis is a lecturer at the Yale School of Public Health. She's former director for the CDC's National Center for Injury Prevention and Control. Linda, welcome to the program.
Thank you.
So what's the purpose of the Injury Prevention and Control Center? Isn't the CDC about diseases?
Yes, and it is, and the Injury Prevention and Control Center really ties in very well with the CDC's mission in that it helps to identify risks for injury and death, disability, all related to injury. You know, we know that there's over 180,000 people who die of injuries each year in the United States. So it's certainly a health issue. And also, you know, many more, probably about 29 million or so people who are injured and requiring some sort of medical care every year. So it's an important piece of looking at any kind of disease.
So this initiative is to train not just data scientists on the use of data, but also doctors, biologists. What do you think of that?
Well, it's very important that we understand the data and we understand how it's used, what kind of data are being used to support any kind of interventions, whether they're prevention strategies, whether they're treatments, whatever they might be. The data are really critically important as a piece of really understanding how to move forward to make some change or improve patient care, increase prevention programs, or do prevention programs that are effective. We need the data to understand how effective they are.
Well, you say when we're talking about data, I guess we should probably ask, how does the CDC use data for injury prevention and control?
Sure.
And how does that impact the agency's function?
Well, the CDC uses data. The CDC uses data that it summarizes. It will look at data that states are putting together about any kind of disease or, you know, injury as well. And it will look at that and it will say, well, where are the issues? What are the problems? And the other thing we find out from the data are what are the risk factors that actually create a risk for disease, create a risk for injury. And what are the protective factors? What kinds of things help protect someone from an injury or from an injury death? So CDC can look at those kinds of things and put them together, take the information, distribute it to the states, to the localities, to programs that are responsible for helping to prevent injuries, and really help people to understand the data and understand what it means and what it means to the people in their community.
So Linda, give me an actual example of
Sure.
the use of data. Let's say when you're studying and preventing something like gun violence, how would that work?
Well, one of the things that we've found out, and CDC has identified and others, that there, for gun violence, 60% of the deaths from firearms are suicide deaths. So one of the things that we can do is we can say, okay, how do we prevent those? How do we use the data to understand what we can do to prevent firearm suicide? So it might be working with, for example, people who are selling firearms to help them understand what the signs might be that someone is intending to use a firearm for suicide. We might look at how families could be educated as to how to safely store firearms so that someone doesn't have access to them for an impulsive act. So there's a number of ways that they could be used, and some of those strategies have been put into place in various locations, various communities, and they've been effective.
You know, data science is always evolving. Where is it going? How do you see the CDC using data in the future?
In the future. I think there's so many ways that CDC is going to be able to use data in the future, and some of it is really keeping current with the evolution of data science, with ensuring that CDC staff are right up there with everyone else who works on data, as far as their current understanding of data, but also understanding what new data sets are evolving. What are some of the innovative ways that data sets can be combined? What about big data? How much can it be used to really inform practice?
All right. Well, Linda, thank you very much for joining us and talking to us about this.
Okay, thank you.